You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, the keys to a natural looking facelift. With us, we have America's plastic surgeon. You've seen him on The Doctors. It played in over 150 countries. With us, we have Dr. Andrew Ordon. Dr. Ordon, welcome to the program.
Randy, so good to see you. You know, we did this 20 years ago, I think. It's like...
Yeah, you were the go-to guy.
Nothing has changed.
Yeah, you look great.
It's been a lot of facelifts over the last 20 years, and if anything, I would like to say, like fine bottle of wine, I'm only getting better.
We talked in the green room that doing facelifts is almost like golfing. You got to do it a lot to stay in the rhythm.
Sure you do. Like anything else, you have to keep your hands busy. You have to follow trends. You have to see what the latest and greatest is, and I've done that my entire career. Having the platform on The Doctors, I got to talk about everything in plastic surgery, but at the same time, it kept me on my toes, and I had to talk the talk.
And now you're known for results, natural looking facelift. And we were talking, I said, bring some photos, but your clientele, they don't want people to know they had anything done. Is that true?
Well, that is true. And Randy, I like to say plastic surgery that doesn't leave you looking plastic, right?
Okay.
So that being said, it's all about natural results, but at the same time, pretty significant results. I mean, you want to show a difference. You want to take that 10 years off, 15 years off. But getting back to your point about before and after pictures, yeah, it's difficult. When you're talking about the face, a lot of people are private. A lot of people are out there. They know a lot of people in Los Angeles, Beverly Hills area. So it's I don't like to start the conversation with a patient saying, hey, I can't wait to post your pre and post-op pictures. Guess what? That's not professional.
Now you have offices. I guess you work a little out of New York, but Beverly Hills area, right on Roxbury.
Beverly Hills, Roxanne Building.
Rancho Mirage.
Rancho Mirage. I've been in both of those locations now for 22 years.
Now, at the top of the show, I said America's plastic surgeon, but you're probably one of the most famous plastic surgeons out there, alive. And so to people...
I have been called that. I have been introduced by other plastic surgeons as the most famous plastic surgeon in the world. And the reason for that, because of the show, as you alluded to, 150 countries, over 2,500. That's big. 2,500 episodes, Emmy Award-winning show. A lot of people saw me out there. And, it was a general medical talk show, but as the plastic surgeon, they did give me leeway to talk about plastic surgery and to show the world what plastic surgeons do. And I did some very cool stuff, cleft lips and palates with Smile Train in India. I went to Haiti after the earthquake and treated burn people. So it showed what plastic surgeons do, and at the same time, I got to show off the cosmetic stuff, the aesthetic stuff, the facelifts, the noses, that I love doing.
You still teach, right, at USC?
Yes.
What's your role there?
Full professor at USC, clinical professor of plastic surgery. The USC residents and the USC aesthetic fellows come to our office in Beverly Hills.
Now, the only dirt I was able to find on you is another plastic surgeon.
Some dirt. You didn't dig. Well, you didn't dig deep enough there,
His
Randy.
only complaint was, well, of course, my facelift would look as good as Ordon's if I had his patient selection. He basically gets a pick of the best, like already pretty people. But do you do facelifts on just regular people?
Randy, that is so important. When you talk about facelifts, patient selection is everything. And ideally, if you're looking at yourself in the mirror and you see something you don't like about yourself, the earlier you address it, the better. You will get a better result, a longer lasting result. So in general terms, in your mid-50s, you're ready for a facelift. So
are the patients getting younger and younger or older and older?
Yes, because we have an operation for everybody. I have a scarless facelift that's essentially a subperiosteal facelift, cheek temple lift that I do through a temporal approach. So for the younger patient in their 40s, essentially,
are they getting them in their 40s?
A little bit, just a little to bring that mid face up.
Okay.
I know my jowl's coming up a little bit there.
And
I'm next.
And the downtime is also decreased.
Minimal with that. Well, in general, with facelifts, for sure. Why is that? Well, techniques have improved. We like to use hyperbaric oxygen to help you heal quicker. We have homeopathic things that we give you to minimize bruising and swelling. We advocate lymphatic massages, sometimes ultrasounds. So all these little add-ons just help you recover that much quicker. But back to patient selection, sure. If you're just operating on 55-year-olds, you're going to be a superstar because their tissue is better, they've aged less. So all those things are going for you to get a great result, but that doesn't mean you're going to turn away the 65-year-olds or the 75-year-olds.
So you do a lot of those?
Well, we do, sure. So the age range we alluded to, yes, it's getting younger, maybe late 40s. I have a cheek temple lift that I do for those people, but in general, start in your 50s better, but I'm not going to exclude 65, 75, but they have to be realistic about their expectations. They have more skin damage, they have more laxity, the skin doesn't.
How many years can you take off on the right person? Well, they look 10 years younger, 20 years younger?
Yes, sometimes more. That we take off, I would say minimum 10 years, and minimum it's going to last 10 years. So in other words, and studies have been done on this, and I think my results are right up there with the studies, that when you compare your before and a 10-year photo, you still look better.
I interviewed you, I think in 1999 or 2000,
it was
somewhere
right
around there.
2000.
What's changed? Are you that much better now?
So much has changed as far as our techniques, learning about endoscopic forehead lifts, learning about temple lifts, which are so important now that we do through an incision in the hair to bring up the corner of the eye and the outer part of the brow. Facelifting techniques, we've learned that with deep plane facelifting in conjunction with skin lifting, I like to call it a bidirectional, because the vector of what you're doing with the deeper tissues, the underlying muscle, and the skin is a little bit different. You're pulling on it's like making a bed. You have the sheet, and then you have the blanket on top. You want to tighten both, but you do it a little bit differently.
Is this true that most facelifts are really just skin pulls? They're not addressing the underlying tissues?
Well, I would say nowadays there is a so-called just skin lift, but I think everybody is doing something to the deeper layers. It's just how much, whether it just be a few stitches or a more complete dissection and tightening internally. And I think that's a key to a great neck, that neck that stands out in that 3/4 view where there's a nice jawline, no jowl, a great cervical mental angle. All of those things stand out. It starts with an incision in the neck, fixing the bands in the neck, and then vectoring the neck in one vector, and then vectoring the mid-face in a more vertical way.
So let's move, and we're talking about the modern facelift. So on the consult, the 50-plus crowd, even younger, you're saying, what do they want? What are they looking for? Like, what questions do they ask? What bothers them?
For most patients coming in for facial rejuvenation, they're holding their neck. This is what bothers me. Now,
it starts to get kind of wrinkly right at the bottom.
It starts with just a little.
I'm seeing it.
We're all seeing it. It starts with a little bit of crepiness, maybe a little bit of excess fat, just losing definition in that jawline. As I said, maybe some banding, just generalized laxity, losing that nice, clean, sharp angle to the neck and jawline. That's where most people are focused, and they start talking about it. Randy, over the years, I can't help but laugh. They come in with photos of them in high school and
is that right?
their reunions and all this stuff. And lot of times I have to go, time out. All right, you're 55. This picture in high school, you were 18 or whatever. You were a great cheerleader, I'm sure, with your pom-poms and all that. We can't go there. We can make you the best you can be for your age, and age appropriate.
Is that what people want? They want to look great for their age rather than different?
Well, that's what I emphasize with them. That's what I want, and that's what they should want. You know, a lot of times, as you know, you've interviewed a lot of plastic surgeons. You're a plastic surgeon in a way yourself. You've heard so many stories that what we do, not only are we making physical changes, but the biggest changes are between the ears. It's your perception of yourself, or there are other things bothering you.
Is that when you should get something done? Like when you look in the mirror and don't like what you see, or you see a person that's exhausted, is that when you should do something about it?
That's a good place to start. Obviously, patient selection, doing plastic surgery for the right reasons, because you have some sort of issue that bothers you, that you look at yourself in the mirror, hey, I'm starting to look a little tired, I'm not looking like myself. Hopefully your friends aren't saying, hey, look at your neck, what happened?
Now, by the way, I have to ask you this. So when we're talking about neck right now, are you always addressing the jowls?
Well, the jowl comes up with your mid-facelift.
Okay.
So as I alluded to, what areas are going to improve with the face? The mid-face, where the volume falls, you lose that nice cheekbone, it falls in the middle of your face, we want to raise that up. The nasolabial line, by doing that vertical lift, we soften that. And then finally, the jowling and what we call the prejowl sulcus, those are all part of the face component of the face neck lift. That's why it's bidirectional, and that's why it's so important to focus on that deep plane, that deep layer.
The underlying tissues. When we're saying deep, we're talking about underlying tissues.
Yes.
Is it more of a repositioning tissues to where they used to be?
Yes.
In a way?
That's exactly what it is. That repositioning, you know, we talk about aging, losing volume, which we know is true, but I think we're seeing it, this trend, people going overboard with volume, blowing people.
What about fillers for things like that? Well, or even nasolabial folds?
Sure. That is one way to go, especially early on when you want to nip it in the bud. But to just rely on volume, volumization, adding to the face, it's gotten out of hand, and you've seen it out there. I mean, these people look like blowfish.
So do you see it?
Well, yes.
They're overfilled?
And yes, and why this is happening, because there's a lot of people in the aesthetic market that don't do facelifts like we do.
Because you do both, right?
I do everything. And they only have one play in the book, and that's volumizing. And yes, we do lose volume, and it shifts with aging, but it's putting things back where they belong, that you will volumize the face. And these studies have been shown, three-dimensional studies, that by moving the tissue in the face, you are volumizing, you're putting that volume back over the cheekbones and below the cheekbones, so-called submalar area, with the facelift. So it's repositioning. Sure, you are removing tissue, you're removing excess skin when you're doing a face neck lift, but the repositioning is what's so key and so important.
You say it's life-changing. That means for them. How so?
It sure is. This is what I see in the office every day, and this is why I love going into work every morning. I'm making physical changes, but we're changing people's lives. We're making them feel better about themselves. We're talking about giving them more confidence, just wanting to go out and conquer the world. I mean, think about it, Randy. Our face is really the only thing that people are seeing of you. Really, it's the first thing that they see. They look into your face and boom. You know, talking about the face, we have to look at the whole face together. They say the eyes are the mirror of the soul, that we can look in and get an idea of what is going on inside somebody. We talk about the mouth, the lips, and that ages as well. So I think we need to talk about rejuvenating the mouth, the smile, the upper lip in conjunction with a facelift, because it's the lips and the mouth that convey emotion and sensitivity. And then finally, we're not going to talk about noses, but nose is something I love to do.
I mean, you like
the noses. I love it. You know, board certified in both plastic surgery and facial plastic surgery. Extensive extra training and experience in the face and the nose. But the nose is the structure on our face that gives us character. So all of those things blend in to give you the face, and then it's the tissue around it, and that's what we're talking about today with the face.
Now, when you're taking like a 55-year-old, their nose, starts to drop, you say?
Part of aging, yes. The tissue in our nose gets heavier. The support of our tip starts to dip. So when we're talking about facial rejuvenation, I get this so often. Well, doc, while we're there, can I just get a little bit of this? Because, and it makes a huge difference. Even for the younger patient getting a nose job, I say, hey, not only is this going to make you look better in general, you're going to look prettier, you're going to be more attractive or more handsome, but also you're going to look younger. A more youthful nose, I mean, goes a long way, and that very often is combined with face neck lift. We talked a little bit about the eyes and the brows. Brows are big nowadays. Yeah. So much attention is being made to brows nowadays with all the different techniques, and you're seeing Kim Kardashian and the rest of these with those meticulous, perfectly arched brows. So people are very attuned to their brows. During COVID, everybody was Zooming and social media doing their stuff, and they really were focusing on a lot of their facial characteristics, especially their eyes. A lot of them had their mask on, so they were focusing on eyes and brows, and brows are so important as far as aging.
So what do you do for the brows?
So go-to for the brows is endoscopic brow lift with a lateral brow lift as well. Release the tissues. The release is so important, and then fixing the forehead skin so that you have a nice natural arch to your brow.
Okay.
Not that surprise look, not that crazy high arch in the middle, just a subtle raising of the brow. You don't do that, then you're still going to look a little aged. You get a face neck lift and forget about the eyes and brow. You're not going to be happy with the result.
What about under the eyes? Bags under the eyes, a lot of filling going on.
Lots of filling going on there, Brandy. You're absolutely right. And for the eyes now, less is more. We talked about it a little bit, that the eyes are so expressive. We don't want anything unnatural about the eyes. We want to clean up that framework around the eyes, but not change the shape, the overall appearance to your eyelids. So with eyelids, less is more now, and on the lowers, especially true. We don't want to go hollowing things out. We don't want to change the shape of the eye. We don't want to get any pull down. So much more conservative on the lower lids, conservative removal of fat, conservative removal of skin with what we call a pinch technique. And the go-to on the lower lids now is fractional CO2 lasering at the same time. Remove a little fat, maybe a little skin, but laser it. Natural, doesn't change the shape of the eyes, and you get a nice youthful look again to that lower lid.
Do people do this or tend to do, facial plastic surgery for occasions, getting married?
Oh, Randy.
Getting a divorce.
Do you know how often, divorce we see too, but fortunately more often, my daughter's wedding is coming up. It's going to be in August. When do we need to do this? Should I do it in the spring so I'll be ready for the summer? I see so much of that. We were talking about high school pictures a second ago. Yeah. Reunions, that's another one that I have a big college reunion coming up. I want to look my very best for that. That's another reason.
Now, Bosley, hair clip for men. Yes. I've had them on the program, but the guy gets his hair back.
Bosley, good guy.
Yeah, they get their hair back and they're hiking and running and swimming. And is that the way it is with a facelift? That means that these people just become more active because of their self-confidence?
That's so
Tell
true
me that.
about facelifts, for sure. We're erasing 10, 15 years maybe off, putting you back in a place in a whole different world where you felt differently about yourself. You're getting that back.
So you start going out more? Is the most expensive part of this procedure going out to dinner all the time and traveling?
Well, maybe so. Just being more active, because it's a natural thing. You feel that much better about yourself. You want to get out there. You want to show everybody the new you, a more youthful, refreshed looking new you. See that with a face neck lift? You can say that about every plastic surgery procedure, that they're doing it because there's something they don't like about themselves, but it translates to just feeling better about yourself.
Okay.
Confidence, poise, being more outgoing, all of these things.
Now, since we're talking about women today and facial plastic surgery, do they want to look pretty again? Do they want to look years younger or great for their age? You kind of talked about
How about all of the above?
Okay.
That's D, all of the above. Those are all the right reasons why they're coming in, and why face neck lifting could be a good thing for them. They want to look more rested. They want to look more youthful. They want to go back in time a little bit to erase the forces of gravity. We can't stop gravity, but we can put things back where they were. And that's another point I want to make, that after today's face neck lift, we're not just removing excess skin, but tightening below. You actually resist gravity better.
Really?
With what we've done on the inside. Yes, by moving tissue, we talked about that, putting tissue back where it belongs and suturing it in place so that you have a more youthful look, which in most cases, you continue to stay ahead of the game. You're going to look younger than your age really forever.
Now, when you were on the show, The Doctors, people thought you said that you weren't practicing anymore and you were doing facelifts the whole time.
Yeah, no, I never stopped
Is that
practice.
right?
Yes.
Even I thought that.
Well, I'm glad we have the opportunity to demystify that. People say, how am I seeing you here in the office today? You're on TV right now. And I go, well, we tape the Paramount Studios Stage 30, and we taped Thursdays and Fridays. We did a heck of a lot of shows in 2 days. We do 4 and 4, so we do 8 shows in 2 days. We would do that 4 weeks in a row, so that's 32 shows we were cranking out in a month. So there you go. There's more than a month of shows that we would do in those 8 days. So the other days I was in my office and practicing, doing everything, and also was doing cases for the show as much as I could. Over the years, I got to highlight a lot of great things, surgeries that I did. You know, we're talking about facelifts. I did a husband and wife couple with a big reveal and then sent them on a cruise, this kind of thing. That was pretty cool. I had another story. This was really touching, like a true ugly duckling story. Somebody that was a recluse and wouldn't go out, wouldn't socialize at all, and on her did a complete facial makeover, kind of like the Swan kind of thing, with nose and chin and a face neck lift, and
Is that
a whole
right?
new different person. She ended up going to her reunion. She got back to us and told us about her experience. I mean, it's those kind of stories that
So their
really-
self-confidence comes back, because that's
Oh.
attractive, right?
Yes. Like anything else, if you have your hair done or your teeth done or whatever, you're feeling a little more attractive, better about yourself. It shows. We all go through that. We've all experienced that. So just magnify that, the experience that you would get by changing something about yourself that you don't like.
We're short on time, but what do you say to the person watching this? They don't like the way they're aging. Maybe in their late 40s, 50s, but for whatever reason, they're afraid of surgery, right? What do you say to them?
Well, I say, how are you feeling? I mean, do these things bother you? Do you look in the mirror and feel like you look tired? Are people telling you that you look tired? Did you not sleep well? Are you getting enough sleep? If you look at yourself and you see these changes and it makes you sad to the point where you're changing your lifestyle. You don't want to go out. You don't even want to go grocery shopping. You're afraid you're going to
Did they tell you this?
Well, yes, they say it to the effect, I've lost my self-confidence to the degree that I just don't like being out socially as much. And that's sad. Life is too short. You want to live life to the fullest. So there's something out there available for you to reverse those changes, to make you feel better about yourself. So why not go for it?
So if somebody, they could go see you in Rancho Mirage, California.
Rancho Mirage Plastic Surgery Institute, or
the LA
Beverly Hills, the Roxanne Building, Roxbury Clinic and Surgery Center.
And so final message. Somebody, because I'm sure when you...
The final message is, Randy, you and I could talk all day long. I love you, buddy. We go back,
thanks.
and congrats on all the success you've had. And
well, thanks. The quality of a show is the quality of the guests, right? So I need more Dr. Drew Ordon on the show.
Sit up straight.
But look, I'm trying not to endorse you on the show, but you literally are the go-to guy when you want a natural-looking facelift. At least that's what people in the know say about you, behind your back. And they say you're a nice guy, too. Well, very humble.
I try.
Good guy.
Well, Randy, that being said, I want to end it on that experience, training, they all count. They all count to translate into having a good experience and a good result with plastic surgery.
What's the best way? Do they go to your website? Do they call? Did they call your office directly? And do they always get to see you on the consult?
Oh no, you get to see me on the consult for sure. For people that are out of town, we do virtual consultations prior to another consultation that's available. And then how do you find me? Yes, go to the website. You can find me there, and we'll have the number for you, direct line to call us, set up an appointment.
Dr. Ordon, always a pleasure to have you on the show. It's actually an honor to have you on the show.
You're a gentleman and a scholar.
Great guy.
How come you haven't aged?
I'm gonna see you. I'm sure in about 10, 15 years.
You know where to find me.
You probably already know exactly
Beverly
what I
Hills.
need, right? In your mind, you probably know.
Well, you're keeping yourself in good shape. Your skin looks great. I mean, we can use you as a model. I haven't seen that much of you in the last 20 years, so sure, things have changed, but you're keeping yourself in shape. Your weight's not fluctuating. Skin is good. Bone structure is good. Those are all working for you. If and when you were ready for a face neck lift, you would get a great result.
Earlier the better, like in the late 40s, 50s.
Well, yes.
What's your oldest patient for a facelift before we go?
Around 75.
Okay, good.
Pushing 80.
All right.
And they do well.
Yeah.
They're thrilled. I just did 175 and did her nose at the same time. She had a bump in her nose that she had all of her life. Never did anything about it. Did her face neck lift, removed the bump. 75-year-old woman, she is ecstatic. She goes, I just went out to lunch with my friends. They noticed everything. I can't thank you enough. She started crying. So a healthy 75-year-old, if things are bothering you, you are a candidate. Randy, the only really big regret that I'm hearing with patients, they go, why didn't I do this sooner?
All right, good. Dr. Ordon, thanks again.
Thank you, Randy.
You've been watching the Wellness Hour news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.